Key points. Research suggests allergies are caused by the immune system overreacting to harmless substances, known as allergens. It seems likely that common allergens include pollen, dust mites, pet dander, certain foods, insect stings, medications, and latex. The evidence leans toward genetic predisposition, environmental exposure, and lifestyle factors increasing allergy risk. There is some debate around the hygiene hypothesis, suggesting overly clean environments may heighten allergy sensitivity. What causes allergies? Allergies occur when your immune system mistakenly identifies harmless substances, like pollen or peanuts, as threats. It produces antibodies, mainly IgA, which trigger chemical releases like histamine, causing symptoms such as sneezing or itching. This reaction can vary from mild to severe, like anaphylaxis, a life-threatening response. Common triggers. Allergens can be inhaled, pollen, dust mites, eaten, peanuts, eggs, touched, latex, or come from insect stings, bees, or medications, penicillin. These triggers depend on individual sensitivity and exposure levels. Risk factors. Having a family history of allergies, conditions like asthma or eczema, and being younger, especially children, can increase your risk. Environmental factors, like pollution and stress, can also play a role. Detailed Survey Note 3. Allergies are a widespread health concern, affecting millions globally, and are characterized by the immune system's overreaction to typically harmless substances, known as allergens. This response aims to provide a comprehensive overview of the causes of allergies, drawing from authoritative medical sources to ensure accuracy and depth. The discussion will cover the immune response, common allergens, risk factors, influencing factors, mechanisms of reaction, types of allergic reactions, and severe outcomes, ensuring a thorough understanding for both general readers and those seeking detailed insights. Immune system response and mechanism. Allergies begin with the immune system mistakenly identifying a harmless substance as a dangerous invader, such as a virus or bacteria. This misidentification leads to the production of immunoglobulin E, IgA, antibodies, which are specific to the allergen, such as pollens or pet dander. The process, known as sensitization, occurs during the first exposure, where the body creates these antibodies to remember the allergen. Upon subsequent exposures, the IgA antibodies bind to the allergen and attach to mast cells or basophils, triggering the release of inflammatory chemicals like histamine, leukotrienes, and prostaglandins. These chemicals cause inflammation and symptoms such as wheezing, itching, runny nose, and watery eyes, which can range from mild to severe, including life-threatening anaphylaxis. The underlying mechanism involves the immune system's attempt to protect the body by flushing out the perceived threat, which can manifest through symptoms in areas like the gut, skin, sinuses, airways, eyes, or nasal passages, depending on the allergen entry method: inhaled, ingested, or through the skin. Common allergens and triggers. Allergens are diverse and can include a wide range of substances. Common categories include airborne allergens, pollen from trees, grasses and weeds, animal dander, dust mites, and mold, often causing seasonal or perennial allergies. Food allergens, specific foods like peanuts, tree nuts, wheat, soy, fish, shellfish, eggs, and milk, which are among the top triggers, especially in children. Insect stings, reactions to stings from bees, wasps, and other insects, which can lead to severe responses. Medications, particularly penicillin or penicillin-based antibiotics, which can cause drug allergies. Other substances, latex and certain chemicals, often leading to allergic skin reactions. The severity and type of reaction depend on the individual's sensitivity and the level of exposure. For instance, seasonal allergies like hay fever peak during high pollen counts, typically between April and May for tree and grass pollen, while food allergies can cause immediate reactions ranging from mild itching to severe anaphylaxis. Risk factors and genetic predisposition. Research strongly suggests that genetic factors play a significant role in allergy development. Having a biological parent with allergies increases the likelihood, as does a family history of allergic conditions. Conditions like asthma or eczema are associated with atopy, a predisposition to allergic diseases. Allergies are more common in children, but they can develop at any age, with some individuals experiencing new allergies later in life due to changing immune responses or increased exposure. Influencing environmental and lifestyle factors. Environmental factors significantly influence allergy development and severity. Exposure to allergens, such as living in areas with high pollen counts or having pets, can trigger reactions. Air pollution and environmental irritants like smoke, perfume, or industrial chemicals can exacerbate symptoms. The hygiene hypothesis, a debated concept, suggests that overly clean environments, particularly in early childhood, may limit exposure to certain microorganisms that help train the immune system, potentially increasing allergy risk. Stress is another factor, as it can weaken immune regulation, making allergic responses more severe. Lifestyle choices, such as diet and living conditions, also play a role, with some evidence suggesting that limited early exposure to allergens might heighten sensitivity. Types of allergic reactions. Allergies manifest in various forms, each with specific triggers and symptoms. Seasonal allergies, often caused by pollen, with symptoms like itchy eyes and runny nose peaking during spring and fall, influenced by tree, grass, and weed pollen cycles. Perennial allergies, year-round reactions to allergens like dust mites, pet dander, or mold, causing chronic symptoms. Food allergies, reactions to foods like peanuts or shellfish, which can range from mild, hives, to severe, anaphylaxis. Drug allergies, reactions to medications such as penicillin, often manifesting as rashes or, in rare cases, anaphylaxis. Insect sting allergies, reactions to bee or wasp stings, which can lead to localized swelling or systemic anaphylactic shock. Latex allergies, reactions to latex products, typically causing skin irritation or, in severe cases, respiratory issues. The overlap of seasonal allergies, especially with early pollen release or rainy conditions promoting mold growth, can extend allergy seasons, making management more challenging. Severe allergic reactions and anaphylaxis. In some instances, allergies can lead to anaphylaxis, a severe, life-threatening reaction characterized by difficulty breathing, swelling of the throat, rapid heartbeat, and a drop in blood pressure. This can be triggered by foods, insect stings, medications, or other allergens like serum, allergen extracts, or chemicals. Anaphylaxis requires immediate medical intervention, often involving adrenaline auto-injectors like EpiPens, and can be fatal if untreated. The risk is higher in individuals with a history of severe reactions or known allergies, emphasizing the importance of carrying emergency medication and avoiding known triggers. Summary table of allergy causes and factors. Category. Details. Immune response. Immune system overreacts, producing IgA antibodies, releasing histamine, causing inflammation. Common allergens: pollen, dust mites, pet dander, foods, peanuts, eggs. Insect stings, medications, latex. Genetic risk factors: family history, parental allergies, conditions like asthma or eczema, atopy. Environmental factors: pollution, smoke, perfume, high allergen exposure, hygiene hypothesis, debated. Lifestyle factors: stress, limited early microbial exposure, diet, living conditions. Age and onset: more common in children, can develop at any age, influenced by immune changes. This table encapsulates the multifaceted causes of allergies, highlighting the interplay between biological, environmental, and lifestyle elements. Conclusion: allergies are a complex condition influenced by genetic predisposition, environmental exposure, and immunological responses. Understanding these causes is crucial for effective management, including avoidance strategies, medication, and, in some cases, immunotherapy to reduce sensitivity. For individuals experiencing symptoms, consulting a healthcare professional for diagnosis and personalized treatment plans is essential, especially for those at risk of severe reactions like anaphylaxis. Key citations: Mayo Clinic Allergies Symptoms and Causes, Cleveland Clinic Allergies Health Information, Johns Hopkins Medicine Allergies and Immune System. Mayo Clinic Asthma Symptoms and Causes. Cleveland Clinic Eczema Health Information. Johns Hopkins Medicine Seasonal Allergies.